drugs, or talk therapy. When a person has a mental disorder, which form of treatment should be used? The mental disorders I'm referring to are the most common ones: schizophrenia, depression, bipolar disorder, anxiety disorders, and attention deficit hyperactivity disorder. Some say psychiatric drugs, while others say talk therapy. They each have their upsides and downsides. Let's explore each of the options. First, let's explore the psychiatric drug option. People think that drugs help more because of the chemicals they release. When people have mental disorders, usually the chemicals that the brain releases makes a person experience a rational amount of emotions, but when the brain is not releasing enough of these chemicals, the person can feel sad or down in the dumps all the time. Once a doctor or psychiatrist prescribes a medicine for the mental disorder, the person usually has to continue to take the medicine for months or even years to treat the mental disorder. Now let's explore the next option, talk therapy. Talk therapy is when a person with a mental disorder talks to a professional in psychology, medical, or social work field about the problems or events that have troubled them or continues to trouble them. With talk therapy, the professional person with a mental disorder gets to the root of the problem and come up with solutions to fix the problems. They can schedule sessions that convenience them. Talk therapy can help because the person with the mental disorder can talk about everything that bothers them to a person that has no relation to them. They will not be judged for their problems or feeling the way that they do. No matter what option is chosen, a person should really think about what they want to accomplish, whether they just want to get rid of the symptoms or get to the root of the problem, or both. These two options can be used together. I have discussed the two options, and now let's talk about the downs. For schizophrenia, the medication are normally taken is chlorzolamine, hydrofil, and quercetin. The side effects for these medications are blurred vision, dizziness when changing positions, drowsiness, rigidity, sensitivity to the sun, weight gain, menstrual problems for women, persistent muscle spasms, rapid heartbeat, restlessness, skin rashes, and tremors. Medications used for depression are Prozac, Celexa, Zoloft, Paxil, and Lexapro. The side effects are agitation, bladder problems, blurred vision, constipation, drowsiness, dry mouth, headaches, nausea, and sexual problems. Medications taken for bipolar disorder are Zyprexa, Abilify, Risperdal, Gideon, and Florizil. The side effects are anorexia, blackouts, changes in vision, changes in weight, excessive thirst, fast, slow, irregular, or pounding heartbeat, frequent urination, hallucinations, itching rash, loss of appetite, loss of coordination, nausea, seizures, slurred speech, stomach pain, swelling of the eyes, lips, face, tongue, throat, hands, feet, ankles, or lower legs, and vomiting. The medications used for anxiety disorders are Klonopin, Ativan, and Xanax. The side effects are blurred vision, cold hair, cold hands, confusion, dizziness, excitement, fatigue, grogginess, headache, lightheadedness, nausea, nervousness, nightmares, trouble sleeping, upset stomach, and weakness. The medicine for the attention deficit hyperactivity disorder: Ritalin, Metadate, Clonopora, Ditril, Adderall, Dextrane, and Dexastrat. The side effects are decreased appetite, headaches, less emotion, sleep problems, stomach aches, and tics are formed. So as you can tell, each medication has a list of side effects. This does not mean that medication does not work. At times, medication may be a better option for certain disorders, but the side effects may not be worth it if talk therapy can fix the causes of the disorder. While there are some cons to talk therapy, it still has less cons than medication has. The cons of talk therapy are that to some people it could be emotionally damaging if the fears or problems are too overwhelming. Also, the person would become too emotionally involved with the therapist. The therapist could use their position to take advantage of their client. These are about all the cons. I'm sure there are more, but they do not affect your physical health. Talk therapy does more good for a person than harm. Confidentiality is number one in the sessions. The only way the therapist will break confidentiality is if the person is threatening to harm themselves or others. So this gives one free will to express all their feelings, thoughts to someone who is not emotionally involved in their lives. They do not have to worry about being judged or looked down upon. So in conclusion, talk therapy is a better option than medication. due to the fact that the cons are much greater in drugs than with therapy. The pros definitely outweigh the cons. Therapy gets to the root of the problem, while drugs only mask the symptoms and people do not talk about what is really bothering them.